Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you yet another COVID-19 community briefing. But today is a special briefing, as you can probably tell. We have some guests. Dee Meerdink, our diabetes educator, and Olivia Chapman, our nurse practitioner in our clinic, are here. And we're excited to have them with us to share their expertise today on diabetes particularly, and particularly relative to COVID. But first, of course, as you know, I need to do my thing. And so what I wanted to do is share a couple things, and there's been some late developments again, particularly with the boosters, but I'll share that in just a minute. First of all, an update. COVID is still very real. It's still quite prevalent in our state. As of this morning, we have 526 COVID-19 patients in hospitals in Iowa, 138 in the ICU, and 82 COVID-19 patients have been admitted in the last 24 hours. In Sioux County, the positivity rate at the state is 8.3%. In terms of Sioux County, the activity has been steady, kind of flat. Still there, but flat, rising maybe slightly. Our 7-day positivity rate is 6.8%, and that is a little bit higher than it's been. In terms of hospitalizations, as of today, we have 0 COVID-19 patients in the hospital at Orange City Area Health System. The state of Iowa has administered 3.6 million doses of vaccine, and according to the state data, 67.2% of Iowans are vaccinated at this point. I need to correct something that I've been talking about before, and it's kind of a technical correction, but it's important and was brought out by one of our viewers, and thank you for that. Where I'm talking about the number of deaths, in fact, that there have been no deaths under the age of 30 in the state of Iowa. Technically, that's right. Technically, that's wrong, depending on how you look at it. Again, along the road here, I've always talked about a book in graduate school that I read about how to lie with statistics. And it's just how statistics can present very different things. And upon further review, when we look at the deaths in 0 to 17 in Iowa, there are actually 3 deaths in that category. But as a percentage, that shows up as 0%. So it's like 0.04%, and rounded, that's 0. And so I was wrong in saying that there were 0 deaths. I was correct if you say 0% of deaths from rounded. So I want to make sure that's clear. We have 3 deaths in the 0 to 17 category and 1 death between 18 and 29 category. I just want to clear that up. I want to jump now into I believe a Sanford screen, and I'll see if I can do this. I just want to show this screen. I think it's a very impactful screen. These are the number of hospitalizations I believe in Sioux Falls, not across the Sanford network. It's more than that, but 219 hospitalized, 198. So the red figures in this area are unvaccinated folks. 54 in the ICU, 52 are unvaccinated. And then Sanford has 41 patients on ventilators. 40 of those patients were unvaccinated. So I think that's a real vivid stat on terms of the efficacy of the vaccine, and something that we've talked about before. Now, what I want to do is talk a little bit quickly before we go to Dee and Olivia about boosters. Last night, there was, late yesterday, the CDC gave final approval to the FDA recommended use of boosters. And what I'm going to do is put this on the screen. And we are already getting calls from folks, many of you out there, on how do we get the boosters. I wanted to put this on the screen so that you have this information. We will be posting this information to our website and Facebook page also. So this is how you qualify. So first of all, most of our vaccines that we gave here were Moderna. And so we're kind of focusing on that. And as you'll see in the end, it doesn't really matter that much anymore because you can mix and match these, but we're going to focus on Moderna. You have to be 65 years of age or older, 18 through 64 years of age with high risk of severe COVID-19. So again, that gets a little more burdensome to figure that out. And then 18 to 64 years of age, like for healthcare workers, for example, or any place where you might have occupational exposure. So I'm just going to stop with this. I'm going to leave it on the screen just for a moment, but this will be posted on our website and Facebook page, as I mentioned. Most importantly, we will be getting information out Monday as to how you can access that. We are working on it today. Most likely that will be accessed through our clinic, but please don't call for an appointment today. We'll be giving that information out on Monday, and I wanted you to have this information before we go on. All right. Now, Dee and Olivia are going to start earning their pay for the day. But I thank you guys for joining us this morning. Really appreciate it. Both Dee and Olivia are tremendous assets to our organization and tremendous assets and resources for our patients. And so we're very grateful for their presence here in our institution. And thank you for being with us today. What I want to start out, and this is probably for my benefit as much as anybody, but others may have the question too. Let's just start out with the really basics. Tell me a little bit about type 1 and type 2 diabetes. What's the difference?
So type 1 diabetes is what we would traditionally think of as juvenile diabetes. People with type 1 diabetes have autoimmune destruction of their beta cells of their pancreas, so they no longer produce any insulin at all. So these are people who are going to have to typically give multiple injections of insulin every day. Type 2 diabetes is different. We think of it often on a spectrum, starting with prediabetes. So people with type 2 diabetes will have increased insulin resistance over time. So we can diagnose them early as someone with prediabetes, but later we do see them have type 2 diabetes.
Are there some symptoms
Pardon?
that show up that help you determine that? Could you talk about that a little bit?
Diabetes is tricky because you can't always have symptoms when it's very early. So if you have anything like frequency of urination, increased thirst, fatigue for no good reason, these are really good things to come in and get checked out. In early stages, really the best way to find out if you have diabetes is routine screening with your primary care provider. Okay.
So what's the big deal? What's the effect of a person with uncontrolled diabetes? Why do we care?
Yeah, I think that's the $1 million question. I think in a lot of ways. And I think that what Olivia said too, some of those beginning symptoms are so vague that we don't always catch it right away. And really what happens is that happens with high blood sugar too. It causes damage to many areas of the body without really causing any pain. And pain's a pretty good indicator, and we don't have that in diabetes. We don't have that pain. That doesn't get people to our door, and so the organs that can be damaged include the cardiovascular system, including the heart, the vessels, especially the vessels in the brain we worry about, kidneys, eyes, and then just nerves. People can end up having nerve pain. Typically we see it start in the feet, but it can be in other areas also. It can affect the heart nerves, it can affect the stomach nerves. I think one of the biggest things we worry about is that people with diabetes are twice as likely to have a heart attack or a stroke. Okay. I mean, that to me is huge. We're talking about life quality here, and so I think that's one of the difficult things about diabetes. A lot of people come into our office and say, I feel fine. I feel fine. And I'm like, yeah, you probably don't know you can feel better though. And so that's one of the things we talk about, and that damage unfortunately can go undetected without, because we don't have those pain indicators, unless we have the routine care, the screenings, annual eye exams, lab tests. And unfortunately, sometimes we get people in our office that damage is already done and we can't get that reversed. And so early detection is huge.
Yeah, so, it sounds like it's a real gradual thing, and people sometimes kind of adjust and get used to things as they go along, not really realizing what they could feel like, right?
Especially type 2 diabetes.
Right.
I always say one of the main indicators is fatigue. Well, walk down the hallway and ask 5 people, how do you feel today? And 4 of them will say, I'm tired, and so we get used to that fatigue, or we sit down in the chair and we fall asleep right away. And we don't realize that is actually our body being stressed from trying to manage that high blood sugar.
Sure. Well, a lot of the stress in hospitals and health systems across the country right now are not COVID related. I think we talked about here, 219 people hospitalized, and I think that's across the Sanford footprint. I thought it was Sioux Falls, but I think it's across their footprint. In Sioux Falls, it might be 40 or 50 people. Okay, but they have 450 people in the hospital. Okay, so there are a lot of things that cancer hasn't stopped, heart attacks haven't stopped, all those kinds of things haven't stopped because of COVID. And in some cases, they're kind of pent up and have come forward. When you look at, particularly regarding diabetes, what have you observed regarding the impact of COVID on people coming in and doing those routine screenings and keeping things in check? Any observations there?
Yeah, we have seen people put off some of that routine care. So then when we do finally see them, we have just so much more advanced diabetes. So it's a lot harder to pick up some of those pieces because we now are not just dealing with high blood sugars, but we're dealing with the consequences of those high blood sugars. Okay. So that's been a real challenge. And then some of our folks with diabetes who have had COVID, they've gotten really ill. So that's just been really scary too, to see some of our people progress so rapidly with COVID.
All right. It came across a statement the other day, and I'm just going to read it, and then we'll move into a little bit of the next subject. And the statement read like this: the answer, if we really want to protect the masses, is to educate and promote healthy living at all stages of life. Improving your health through a healthy lifestyle, sunshine, fresh air, and real food is the best way to protect the most people. We've referred to this concept over the last 100 plus briefings here as keeping your engines tuned, right? Or keeping your engine tuned. And we've often mentioned things like blood pressures, blood sugars, diet, exercise, mental health, the sunshine factor, so to speak. What does this concept specifically mean relative to diabetes? Let's talk about keeping your engine tuned relative to diabetes, and talk about the role maybe even that diet and exercise play in that.
I think that's so interesting when you read that, Marty, because so often when I do my education, I talk about that a lot of times I view our body as this wonderful, complicated machine, and when we talk about blood sugar, I like to get down to the element of what really is blood sugar. Why does our body have blood sugar? And it's just our fuel. It's our energy, so if we want to think about that in the concept of a machine, it's kind of like the gas in your car, right? I mean, it's the gas in your tank. And our organs, our muscles, our cells are our engines. That's where the work is done, okay? So what happens with type 2 diabetes is that we've got all of this fuel, but it's not getting into the engine. It's not getting to where the work is being done. And so that's the balance that we're trying to achieve. And how do those sugars get into those organs? It's through insulin, and insulin is kind of the key to open up the door so that that can be used. But also not only, so, diabetes really is an insulin problem, that either we're not using it or we're not making it, after Olivia's definitions there. But also it's about how much fuel we're putting in that tank. Do we have the appropriate amount of fuel? And that's diet. And are we making our engine run more efficiently? And that's the activity part of it, so I think a lot of times when people come into our office that we're just going to say, you can't eat this, you can't eat this, you can't eat this. That is not our message at all. It's about, carbohydrates are the foods that our body turn into sugars. And it's about the right carbohydrates and the right amount of carbohydrates and the carbohydrates that are giving us the most benefit health-wise also too. So our message really is moderate carbohydrate intake. That doesn't mean that I'm going to tell you can never have a piece of pie again, because that'll get me kicked out of Sioux County. But we do talk about, limiting those and limiting sugary drinks and that type of stuff, keeping the appropriate amount of food or keeping the appropriate amount of fuel, if you want to say, in our bodies. Activity, I like that word better than exercise. I think sometimes exercise can kind of feel like a barrier. Yeah.
You might have to sweat.
Yeah, exactly. And I just want you to move more. Just, if you're doing nothing, walking to the mailbox is moving more, and then building on that. And because, and people say, oh yeah, they tell me I should go for a walk. Well, why? Why should you go for a walk? Because I want your muscles, I want your engine, I want it to be hungry. I want it to want that energy. And by reducing that insulin resistance, that is what that activity does, so moving more, I think, is my biggest message for most of us. And I need that message too multiple times, but those, and people say, well, I take pills or I take my insulin. That doesn't stop what our body needs to work best.
I think you mentioned something to me one time about people taking their pills, that you should really treat activity or movement in the same manner as taking your daily vitamin or your daily pill or whatever. Just like you don't want to miss a dose, so you don't want to miss activity either.
Yep, I absolutely agree with that. And that doesn't have to be the same thing every day, but being consistent is a big part of that. Yeah.
Right. So how do we get our cars into the shop? How do we keep that engine tuned? How can OCHS help? How do they, if somebody wants to talk to you, either of you in more depth or any of our providers, how do they get an appointment to get the engine checked?
We would love to see any of you for just an annual exam and talk about what are your risks? What do we need to test for? Do we need to just check a blood sugar? Do we need to do an A1C, which is a 3-month average of your blood sugars? Do you have high risk? Should we be doing checks a little more often? Or are you even in that pre-diabetes stage right now? And do we need to make some changes today so we never progress to type 2 diabetes? And if you do have diabetes, come make an appointment with me, make an appointment with Dee. We would love to be on your team and advocate with you for your health. We're here to partner with you, not to just lead. We want to lead you. We don't want to do it for you. So we'd love to be part of your team.
So really, you guys are in a way a referral source, right? I mean, folks come in, they have their annual physical, they have their blood work, and there might be somebody that's in a pre-diabetic stage or whatever the case, or maybe would benefit from you. So, so folks out there, I think the main reason or the main message here is whoever your healthcare provider is, keep those annual things going on.
Yep.
And if you have the opportunity, I won't say if you have the need to, but if you have the opportunity to visit with Dee and Olivia regarding an issue, they're a great resource and we can provide that information. I think that's as complicated as it gets today, guys. So, do you guys have anything that you would like to add specifically before we close?
I think I would like to add the risk factors. Olivia said that,
Okay.
you know, what are the risk factors? And I think it's important for people to know, because if they don't understand what they should be looking for, they're not looking for it. So
Good.
risk factors are family history. You know, did grandpa and grandma have it? Did mom and dad, you know, that type of thing. Just being over the age of 45 is a risk factor. Being overweight, not being physically active or less physically active than you were previously. Even just having high blood pressure makes you more at risk. Having low good cholesterol, which is HDL. If you had a history of gestational diabetes when you were pregnant, you know, that can be an increased risk factor. Having polycystic ovarian disease. And then also just certain ethnic groups, African Americans, Asian Americans, Pacific Islanders, Hispanic, and Native Americans all have an increased risk. So, you know, we need to be aware of what our risks are. How can we mitigate some of those? Because we can, you know, I can't change my family, you know, that type of thing, but I can be more active. I can, you know, watch my weight, you know, those type of things. But if you have those risk factors, yes, that's something you should be talking to your provider about, because those are when the routine screenings really are so beneficial.
You know, this thought just came across too, but we have some pretty cool things now to keep folks to help monitor these things, right? I mean, maybe not daily finger pricks. Could you give a quick rundown on some of those technical things that we have?
Yeah, we both are certified in pump management, so we can help with insulin pumps, with continuous glucose monitors. We would love to help you with those, or transition to one if you do qualify for that. We have all different medications out there, some really cool ones with some neat administration techniques. Dee is also certified in providing diabetic retinal eye exams through our facility, so we can help you with that here in the office too.
Yeah, I guess the list is kind of long when we look at it. So, you know, and the CGMs are just, they've kind of exploded. That's the continuous glucose monitors. And there's a lot of ways, even if you don't qualify, sometimes we can help you just to wear that for a couple of weeks, because I've had people just even telling me just doing that just kind of opened up their eyes about their blood sugars and, you know, how things affect their blood sugar. So that's been very helpful. And all of our providers really, you know, are open to using those kind of technologies.
Sure. So, I mean, thank you for bringing that up. And so I don't want to say that you guys aren't accessible directly by patients. So if somebody has a question, you can ask to speak to one of these two folks. And but I wanted to say really the gateway to you guys is really through your regular provider. But it doesn't mean that you're off access.
No.
No,
especially me. You can call the clinic and ask to speak. If you have diabetes or have a question about diabetes, call the clinic and ask to speak to the diabetes educator, and that'll get me.
737-2000.
Yeah.
All right. Well, thank you guys for being with us today. Really appreciate the time that you took to prep for this and get ready for it. Appreciate that a lot. And but more importantly, appreciate you being part of our team and appreciate the work that you provide to our patients. So on their behalf, thank you very much.
You're welcome.
And so I don't have the next briefing scheduled yet at this point. But again, to go back to probably the topic of the day right away is the booster thing. So look for more information on the boosters, most likely Monday. I know people will be working on it today. And I would expect probably 65 and older being at the beginning of the queue. And that's certainly the simplest way to go. But look for more information on that. Check our website, our Facebook page, and we'll be in touch. And again, for all of you who use Orange City Area Health System, thank you. We appreciate that, and we will never take that for granted. Thank you, guys. See you, Dee and Olivia.
Bye.
Bye-bye. Thanks.